Well, Jimmy knows I've certainly had my share of debilitating migraines, pain that just brings my day to a screeching halt. Well, for the 36 million other people who also know what it's like to get a migraine, you'll be happy to hear that a drug to prevent migraines, not just treat them, is in the works. This new class of drugs called CGRP monoclonal antibodies works by reducing the peptide in the body that drives migraine pain. 4 pharmaceutical companies are testing the drugs and are said to be seeing positive results. Still, it may take years for the treatment, which is a monthly injection, to be available, but one leading headache researcher says the development of CGRP antibodies offers the simple yet elegant and long-awaited option for migraine patients to finally be treated with migraine preventatives. It's truly landmark development. Now, obviously, awesome news. I know that if I could just have something that to make them go away, I would be.
You'd be happy with that?
Thrilled.
Well, it looks like it's just a waiting game right now. So until researchers do come up with the meds to prevent migraines, let's go ahead and talk a little bit more about treating the pain. Now, I never really have gotten migraines, but bless your heart, when I see one coming onto you, I hurt for you. I know not nearly as bad as you do, but I hurt for you. It's a pain that often feels like it's just not going to go away, and for some people, the suffering is nearly constant. According to the Migraine Research Foundation, migraine ranks in the top 20 for the world's most disabling medical illnesses. While most sufferers experience attacks once or twice a month, 14 million people, or about 4%, have chronic headaches, meaning attacks occur at least 15 days out of each month. More than 90% of those sufferers are unable to work or function normally during a migraine. Now, when it comes to treatment, many people rely on a strong daily medication. But what if I told you there was a treatment out there to eliminate this pain without medication? Today, we're going to step into the OR to meet a doctor who says he's discovered a new way to relieve migraine pain.
Imagine living for decades in chronic pain. That's been Gary Goodlet's life.
I had no view of the perimeter. I couldn't move my eyes. I couldn't bend my head. If I bent my head down, I felt like my head was going to explode.
Gary believes the pain he feels this day and every day is from school football concussions and injuries. His chronic headaches were treated with opioids. Those addictive painkillers changed his personality. The symptoms changed his life.
It was so hard to see him in pain because this wasn't the man I married. You know, he was so active, excuse me, and energetic. And then for so long, he just sat there.
Life became going to work as a hospital cath lab technologist and coming home to his sofa. Then Gary had a chance to be one of the first to try something different. Neurologist and interventional pain expert Dr. Chad Domingue was an expert at using internal nerve stimulation. On the market for years, an implant sends impulses along the nerves interrupting the pain signal to the brain with a pleasant sensation.
It takes away that chronic ache. It takes away that burn, that throb, the alarm system that won't shut off.
But Dr. Domingue had a theory. Instead of stimulating 2 nerves in the back of the head where people feel the headaches, he thought of stimulating 2 extra nerves where the headaches start in the base of your skull near the spinal cord.
So not only did I put the wires at the base of the skull, but I put the wires actually in the neck because the headache center actually dips down into the neck.
His 3-year study on 15 patients made the cover of a peer-reviewed medical journal. The patients said it changed and even saved their lives.
Everyone that I've put it in has done extremely well. I've never taken one of these systems out because they didn't like it.
Gary was one of those test patients. It worked so well, he was eligible for updated new technology. A team of more than a dozen people were in the OR as Dr. Domingue removes the old implant and puts in the new. The team from the implant company's in the OR too. Immediately when Gary wakes up in the recovery room, they're testing the different stimulations. Then, just 1 week later, a man who loved doing home renovation is refinishing his front door.
I told my wife on the way home, I said, I forgot what it was like to feel this way.
His eyes got blue again, his color came back. You could just see it. He was like a relief. You know, he's finally not in pain, finally.
Isn't that something? Now, you need to know that for each implant, the Goodlet family actually had to fight with the insurance company to get approval for the nerve stimulation treatment. It even got to the point they needed the help of an attorney.
That's interesting. But you know, it's amazing to see that you can get that relief from the debilitating pain by nerve stimulation. Well, believe it or not, stimulating the brain may work wonders when it comes to certain health conditions like attention deficit disorder, Parkinson's, and Alzheimer's. Up next on Delmarva Live, how a chiropractor, yes, you heard me right, a chiropractor can drive that stimulation to increase your body's function overall.
Now, we're not the only ones who get sick. It's also important to keep an eye on our pets. While you and I may be out of the woods when it comes to the flu, guess what? They're not. So still ahead, the signs to look for and how you can keep Fifi and Fido flu-free this summer.
Along with summer comes soaring temperatures. Later, a few tips and tricks on keeping your pets cool, healthy, and happy this summer.
But first, we just learned about migraines. But what if your head pain's from a concussion? Dr. Oz has more on what you need to look for.
Hi, I'm Dr. Oz. Do you know the signs of a concussion? They can occur as many as 2 to 3 days following a head injury. Symptoms include a headache, dizziness, nausea, vomiting, and balance problems, as well as difficulty concentrating, memory loss, and trouble sleeping. If you suspect your child has had a concussion, take him to a doctor for an exam immediately.